Good afternoon and happy spring. My name is Kathy Hickey and I'm the project coordinator for Massachusetts Family Voices, a project at the Federation for Children with Special Needs. Welcome to Family Voices webinar on Accessing Children's Behavioral Health Initiative. We're so glad you're able to join us. I'd like to give you a little background on the Federation for those who are new to us. The Federation for Children with Special Needs started in 1974 by a group of parents who were part of a coalition that pushed to get the first special education law in the country passed. The Federation provides information, support, and training to families whose children have special needs, special health care needs, and children who are at risk culturally, linguistically, or economically. Helping families access and advocate for quality health care for their children with special needs is just one of the Federation's many projects. I will be facilitating the webinar today. This webinar will be recorded and archived at a later date on the Federation's website. A few technical pointers. Please be advised that everyone will be muted except our presenter. If you have any questions, please use the webinar toolbox that allows you to type in questions and we will answer them either during the presentation or I will collect them for the question and answer portion of this webinar, which will follow the presentation. Our webinar today will be presented by Darcy Rubino, Health Information Specialist at Family Voices. Welcome, Darcy. And also a big thank you to our IT Director, John Sullivan.
Thank you, Kathy. The Family to Family Health Information Center is a project of Mass Family Voices. We're funded through a federal grant made available through the Affordable Care Act, and also the U.S. Department of Health and Human Services, Health Resources and Services Administration, the Maternal and Child Health Bureau, and the Division of Services for Children with Special Health Care Needs. Family to Family helps families and professionals who have or work with children and youth with special health care needs access health care, resources, and learn how to make informed decisions about healthcare services and supports. Welcome to the Mass Family Voices Family to Family Health Information Center's webinar, Roadmap to CBHI, How to Apply for Mass Health and Access Children's Behavioral Health Initiative Services. What will you learn today? As we go along, you will notice that this presentation will be broken up into two parts: How to Apply for Mass Health Common Health and CBHI. So we will be learning what is Mass Health Common Health, how to apply for Mass Health for your child with a disability, the Mass Health application process, what is CBHI, how does my child qualify for CBHI, and how to get CBHI once my child is approved for Mass Health. Mass Health Standard is the Mass Health version of Medicaid. Coverage includes medical, dental, vision, and behavioral health services, to name a few. You can qualify by income level, which is low to no income, which is called Mass Health Standard, or by disability, which is called Mass Health Common Health. Common Health is Mass Health for children who have a primary insurance through their parent or guardian's employer, COBRA, or have purchased through the Health Connector. For example, a parent pays for an employer-subsidized insurance plan like Blue Cross, Blue Shield, or Tufts, and has Common Health as a secondary insurance for their child with a qualifying disability. There are 3 steps to applying for Mass Health Common Health. Step 1 would be to fill out the application for health coverage and help paying costs form. As you can see, the link is listed here on the slide. Step number 2 is that you would need to fill out the Child Disability Supplement. This form is also listed on the slide, and this is where you would describe your child's disability and how the disability affects them over different domains in their life, such as community, home, and school. Step 3 would be to fill out the Mass Health Medical Release Forms, and you want to do that for all providers that can substantiate your child's disability. Also, here is the link to the application as well for the medical release forms. Now we want to discuss how does the disability evaluation services determine if your child has a disability. DES has a 3-step review process. What are these steps? DES will want to know, does the child perform substantial gainful activity? This step will be waived in Massachusetts for the child in review. Step 2 is the impairment severe? DES requests individualized functional assessments prior to determining that a child's impairments are not severe. If the child does not meet or equal a child's disability listing, however, they have an impairment that causes more than minimal or slight limitation in age-appropriate functioning, the child will be considered disabled. They would also like to know about the duration of the impairment. Is it determined to last more than 12 months? Has it lasted more than 12 months, or will it result in death? The third step would be, does the impairment or combination of impairments meet or medically functionally equal the severity of any of the listings? Once you have completed the application for health care and paying costs, the child disability supplement, and the medical release forms, you will want to mail them into either the Health Insurance Processing Center or the Disability Evaluation Service. You will notice that you need to send the Mass Health application and the child disability supplement to 2 different addresses. On the left, you will see that the application for health coverage and health paying cost forms goes to Health Insurance Processing Center in Taunton, Massachusetts. On the right, you will see that disability form will go to a Worcester address. Here are some tips for making the process smoother. You want to make copies of everything you're sending to Mass Health. You also would like to send in all of your evaluations, doctor's notes, IEPs, or anything that you have that can substantiate the disability, and that would all go with the disability supplement form. 1 to 2 weeks after you mail in everything, you may want to try to call the Disability Evaluation Services to make sure that they have your application and ask if there's anything that you need. You also may call once you get a letter from Mass Health stating that you don't qualify based on income. This may happen because the application for Mass Health and the child disability form have not caught up with each other in the Mass Health computer system. At that point, call disability and let them know that you've sent in your application, and if there's anything else you can send them to make the process go smoother. Now we're going to talk about managed care entities. A managed care entity is a company that has been selected to provide behavioral health services. It's almost the same as a carve-out plan that your primary insurance may have. For example, your primary insurance may carve out their pharmacy or behavioral health services to a separate company. Once your child has been approved for Mass Health or Common Health, you'll need to select your managed care entity to be your behavioral health provider. Here is a list of the MCEs, or managed care entities, that Mass Health has. Mass Health Behavioral Health Partnership, or MBHP, Health New England, Fallon Community Health Plan, Neighborhood Health Plan, BMC Health Net Plan, or Beacon Health Strategies. You may want to check with the agency you will be using for your child's behavioral health services to make sure that they accept the MCE you want to select. Note that if you have Common Health, MBHP is the only MCE available to you. So if you have Common Health, the only department you need to call is MBHP. If you have questions regarding the Mass Health application process, specific to you or just general, please feel free to call us at the Family to Family Health Information Center. You can speak to myself or Kathy Hickey, and our phone number is 1-800-331-0688, extension 301. Now we will begin the section on CBHI. What is CBHI? CBHI stands for Children's Behavioral Health Initiative. How did it begin? The Children's Behavioral Health Initiative is an initiative of the Commonwealth Executive Office of Health and Human Services to meet the needs of children and youth in Massachusetts who have serious emotional disturbance, SED, and their families. It initially came about due to a class action lawsuit filed on behalf of Mass Health enrolled children under the age of 21 with serious emotional disturbance. The CBHI mission is to strengthen, expand, and integrate Massachusetts state services into a comprehensive community-based system of care to ensure that families and their children with significant behavioral, emotional, and mental health needs obtain the services necessary for success in home, school, and community. CBHI values include being family-driven, child-centered, and youth-guided, along with being strengths-based and culturally responsive. They also value collaboration and integration, and they strive to be continuously improving. Does my child qualify for CBHI services? To be eligible for CBHI services, your child must have a qualifying behavioral health diagnosis. If you are looking for ICC services, which we will discuss later in a later slide, they must have an SED and be under the age of 21. What is an SED? We refer to mental disorders using different umbrella terms, such as emotional disturbance, behavioral disorders, or mental illness. Beneath these umbrella terms, there is actually a wide range of specific conditions that differ from one another in their characteristics and treatment. These include, but are not limited to, anxiety disorders, bipolar disorder, which is sometimes called manic depression, conduct disorders, eating disorders, obsessive compulsive disorder, or psychotic disorders. The CBHI services are coordinated across multiple service systems and include intensive care coordination, family support and training or family partners, in-home therapy services, therapeutic mentoring services, in-home behavioral services, and mobile crisis intervention. We will discuss each service in the upcoming slides. Intensive care coordination, or ICC. In ICC, a care coordinator helps you bring together the main supports in your child's life so that everyone is working together to help your child. You choose who is on your team, including professionals like therapists, social workers, or teachers, and your natural supports like friends or relatives. Family support and training, or family partner. Family partners help parents and caregivers help their children reach their treatment goals. They are parents or caregivers of children with special needs. They've been there and understand what families go through and can share their experiences. Family partners are not behavioral health professionals, but work closely with parents to help them get the services their children need. In-home therapy. If your child's behavior is making daily life hard for their family, then in-home therapy may be right for your child and family. Counselors work with your whole family, helping you as a parent to help your child. In-home therapy can help your child and family to resolve conflicts, learn new ways to do things, make new routines, set limits, or find community resources. Therapeutic mentoring. Some children want to get along with others but need help and practice learning to talk or act in new ways. A therapeutic mentor will go with your child to the places where your child has the most trouble and teach him or her new skills, such as better ways to talk or act with other children and adults. In-home behavioral services. Sometimes a child will do something over and over that bothers other people or harms the child. If it is hard to get the child to act differently, a therapist will work with you and others in your child's life to try new ways to help your child change these behaviors. Mobile crisis intervention. Mobile crisis intervention can be utilized when your child is having a crisis and needs help right away. Mobile crisis can also meet with the family other providers, school, or whoever the family chooses, before a crisis ever occurs in order to assist with safety planning and crisis prevention. You may call 24 hours a day, 7 days a week. A trained team will come to your home, a school, or other place in the community to help your child with the crisis. The team will also help you get other services for your child and family. This slide depicts the CBHI service delivery system, including why a youth would need each individual service. For example, if we looked at ICC, Intensive Care Coordination, Hub Wraparound Service. Youth has a serious emotional disturbance. The youth is functioning poorly in the community. The youth has or needs multiple services or state agencies, or the youth requires an intense service or care coordination. What is a hub? In CBHI, a hub is very important. A hub is a service provider that your child has to be referred to some of the CBHI services. What does it mean to be a hub? All three of the following hubs provide care coordination in varying intensity. They help the caregiver and youth to explore viable options to meet the youth's needs, make informed decisions about utilizations of service and other ways to address needs. They help make linkages to natural supports such as family or friends, and also make linkages to hub-dependent services like therapeutic mentoring, in-home behavioral services, or family support and training. They also collaborate, coordinate, and integrate care interventions by holding meetings with family and other treatment providers, having regular phone calls to collaterals, obtain regular updates from therapeutic mentoring, in-home behavioral services, and family support and training. Now we're going to discuss the hub-dependent services. So which are the hub-dependent services? Hub-dependent services are therapeutic mentoring, in-home behavioral services, and family support and training or family partner. This means that you have to have a hub in place before any of these referrals can be made to these three services. This slide depicts the clinical hubs in order of intensity. Intensive care coordination is the highest level of care, followed by in-home therapy, and then outpatient therapy. It is possible to have all three of these services at once, and if that is the case, then ICC, or intensive care coordination, is the highest level of care. How do I start CBHI services? A referral must be made to one of the hub providers. If your child already has a therapist, ask her or him to make a referral for services. There are different kinds of referral types. Examples would be a self-referral. The parent would call a hub provider, such as ICC, outpatient therapy, or in-home therapy, and give information about your child. A school could make a referral to the hub provider. Or also an agency referral, such as DCF, could refer to a hub provider. Only hubs can refer to hub-dependent services. If you or someone else, including school or state agency, thinks your child would benefit from a hub-dependent service, they would call your child's existing hub provider to discuss the need for the hub-dependent service and ask that they make the referral to the hub-dependent provider. Now we're going to talk about a community service agency, or a CSA. A CSA is a community-based organization whose function is to facilitate access to and ensure coordination of care for youth with serious emotional disturbance, or SED, that require or are already utilizing multiple services or are involved with multiple child serving systems. For example, child welfare, special education, juvenile justice, mental health, and their families. CSAs are regional. You can find more information about which agency is your CSA at this link. Examples of CSAs would be Luck Inc., Leahy Behavioral Health Services, Elliott Human Services, Riverside Community Care, the Home for Little Wanderers, or Wayside Youth and Family Support Services. CSAs are where ICCs, intensive care coordinators, and family partners work. ICC services are often referred to as wraparound services. Wraparound service means a philosophy of care with a defined planning process used to build constructive relationships and support networks among students and youth with SED and their families. It is community-based, culturally relevant, individualized, strengths-based, and family-centered. Wraparound plans are comprehensive and address multiple life domains across home, school, and community, including living environment, basic needs, safety, and social, emotional, educational, spiritual, and cultural needs. What should I expect once services start? When you have an ICC or family partner, the family and ICC determines the appropriate number of hours per week or month for family support and training services based on the needs of the youth and parent or caregiver as identified in the ICP, also known as the Intensive Care Plan. The care coordinator will maintain at minimum weekly contact, either over the phone or face-to-face, with the family of each enrolled youth they support. In ICC, once you have your first care plan team meeting, referrals can be made to other CBHI services. Therapeutic mentoring will have identified goals as part of the ICP or on the treatment plan if a youth sees a therapist or in-home therapist. Parents or guardians will meet with a mentor for an intake, and services with the youth will start once scheduling can be worked out. Expect the first 4 to 6 weeks of work to be around the mentor and your child building rapport. In-home therapy will meet with families at a frequency that is responsive to the clinical needs or goals. Some families will have meetings twice a week, some will have more. The length of time IHT services are in place are dependent on how long it takes to achieve the goals. Feel free to ask your clinician about success rates and average length of time for service. CBHI can be a valuable service to youth and their families. If you have specific questions regarding your local services, you can reach out to the agency that covers your catchment area. If you are having trouble locating who covers your area, please feel free to call us at Mass Family Voices, again at 1-800-331-0688, extension 301. And now we will answer any questions that you have.
Okay. Our first question is, what is the difference between IHT, in-home therapy, and IHBS, in-home behavioral services?
In-home therapy is really a service that will work with your family. It's basically therapy in your home. They're going to be working on strengthening family bonds, sibling issues, parental issues. In-home behavioral services, basically they will do a functional behavioral assessment and work as in a team of 2. There will be a monitor and the person who comes into the home all the time. They're going to work on behavior in the home. They'll use maybe sticker charts, things of that nature to change behavior that is not favorable that's going on. It is not skill building, however. It only works on helping to change inappropriate behavior.
And our next question is, can you please clarify the difference between a hub and a CSA?
Okay, so a CSA is the agency that has the intensive care coordinator and the family partner. The intensive care coordinator is the hub. They are the highest level of service, meaning that everyone will report to them. The hub can also be a private clinician that you see through outpatient therapy or in-home therapy. Like I said, you can have all three of those hubs, but ICC, who works at the CSA, sorry for all the acronyms, is the hub. And the hub is the person that gets all of the insurance information in line. So they'll be making referrals, and they will also be have regular contact with the insurance to make sure that the service is going the way it should be going.
Okay, and the next question, how is CBHI the same or different from the similar services that are available to families who are supported by the Department of Developmental Services?
So if your child has DDS coverage, that means they have an intellectual or developmental disability. Mainly CBHI services are children who have mental health or behavioral health issues. There is a lot of overlap now. A lot of children with autism who receive DDS services have comorbid diagnoses such as anxiety or depression or ADHD. DDS will provide some care coordination, but I believe that it's not at the level or as intensive as obviously intensive care coordination will be. They meet, when you have ICC, you will have a care plan team meeting within the first 28 days of enrollment, and then after that you will have a meeting every 30 days until I think the third or fourth month, and then you can space it out to be every 6 weeks or so. But they're definitely intensive, and they cover more family issues, I want to say. So if mom is having trouble finding a job, ICC and family partner will help with that. I'm not so sure that DDS covers that intensive of the service. Okay, and another question. In a divorced family.
Our next question, in a divorced family where both parents share legal custody, is it necessary to have both signatures of parents to apply for CBHI and Mass Health?
That's a good question. Not for Mass Health. For CBHI services, they will often try to get the other parent's signature. If they do have split custody and it's legal in writing, they will have to get the other parent's permission. That does not mean that they have to meet with that other parent. A lot of ICC, family partnering, or in-home therapy, they will work with both parents separately, maybe come together at the team meetings, but mostly they will be looking for a signature from both parents.
And the next question is, will the slides for this presentation be posted or shared on a website?
Yes, we are going to have the webinar available on our website as soon as we can get them up. And also, if you have questions that you're not comfortable sharing, feel free to send us an email and we can answer your questions, or you can give us a call.
If anybody else has any other questions, feel free to post them and we'll try to answer them. We'll stay on for another couple minutes to see if we get any more. Otherwise, thank you very much for attending. And the next question is, hold on one second. Okay, the next question is, if autism spectrum disorder is the primary diagnosis and high anxiety diagnosis is secondary, what should we apply for?
So it would be, I think that if the anxiety is really playing a role in your child's life, I think that CBHI services might be something that you might want to apply for. It really depends on how the anxiety is affecting your child, and again over the school, home, and community domains. It's always good to call your local CSA or in-home therapy agency and talk to them about what's going on, because they're really the front line and they'll be able to refer you to the best and most appropriate service. I will say that there are a lot of children on the spectrum that have the comorbid diagnosis of anxiety or ADHD, and they do receive CBHI services. They may not be eligible, or they will not be eligible for DMH single service services, which are usually through CSAs, meaning respite, camp, anything like that, because that would be covered all through DDS if you have a child with a diagnosis of autism.
And another question is mood disorder a qualifying diagnosis?
Yes.
And will the PowerPoint be available for download?
Download, no, but you'll be able to view it on the Mass Family Voices website.
Any other questions? So if you do have questions, feel free to email us at chickey@fcsn.org or drubino@fcsn.org, or give us a call at
1-800-331-0688, extension 301.
Thank you and have a great day.
Have a great day.